Hello everyone, welcome to my in-depth exploration of AI ethics in healthcare. AI is revolutionizing the field with enhanced diagnostic accuracy, personalized treatment plans, and significant cost reductions. However, this rapid technological leap introduces a web of ethical dilemmas that we must address to ensure patient safety and equity. Over the next few minutes, we will unpack the core principles, real world challenges, legal frameworks, stakeholder impacts, and actionable solutions. Let's get started. At the heart of ethical AI in healthcare lie five fundamental principles. First, fairness. This tackles biases in AI models that might disproportionately affect marginalized communities, especially when training data lacks diversity. Research by Obermeyer and colleagues in 2019 highlighted how biased datasets can skew outcomes. Second, accountability. Who bears the responsibility when an AI-driven decision leads to harm? Is it the physician relying on the tool, the developer who coded it, or the institution deploying it? This question remains unresolved. Third, transparency. With the rise of black box algorithms, patients and clinicians need clear insights into how decisions are made. Fourth, privacy and security. AI's reliance on vast datasets heightens risk of breaches, making compliance with regulations like HIPAA and GDPR critical. Finally, responsibility calls for continuous ethical oversight to prevent long-term societal harm. These principles form the bedrock of trustworthy AI systems. Beyond these basics, contextual frameworks enrich our approach. Contextual integrity, proposed by Nissenbaum in 2004, ensures AI aligns with the societal norms and expectations. Value sensitive design. Value sensitive designs integrates stakeholder values into technology development. These approaches emphasize two key ethical duties: beneficence, actively promoting patient health, and non-maleficence, avoiding harm through untested and or biased systems. AI, for instance, AI must not deepen health disparities. Marginalized groups, often underrepresented in datasets, risk being excluded from AI benefits unless diverse data and bias correction are prioritized. This alignment with societal values is crucial for equitable healthcare delivery. Now, let's examine some real-world examples that bring these issues to life. So first, IBM's Watson for oncology promised to revolutionize cancer care, but faltered when a 2018 internal report revealed it issued unsafe treatment recommendations. This stemmed from theoretical data rather than real patient cases, encoding trust and underscoring the need for human oversight, as reported by Ross and Swelitz in 2017. Second, Google's DeepMind collaboration with the UK's National Health Services to develop the Streams app for diagnosing acute injury hit a major snag. In 2017, it was discovered that 1.6 million patient records were shared without direct consent, leading the UK Information Commissioner's Office to rule a breach of data protection laws, as noted by Pauls and Hodgson. This raised alarms about privacy and security, privacy and transparency. Third, an algorithm by Optum used to predict healthcare needs showed racial bias by underestimating care requirements for black patients, despite not explicitly using race in its model. Another finding from Obermeyer in 2019. These cases highlight the urgent need for robust ethical controls. To navigate these challenges, legal and regulatory frameworks provide a structure in the US. The Health Insurance Portability and Accountability Act (HIPAA) mandates a strict data privacy and security, ensuring AI systems protect patient information and unauthorized access. In the European Union, the General Data Protection Regulation (GDPR) imposes rigorous rules on data processing, including consent, transparency, and accountability for AI models. Globally, organizations like the EU, WHO, and IEEE have issued AI ethics guidelines, stressing fairness, transparency, and patient-centered design. Adhering to these standards is essential for ethical AI deployment. Now, AI's ethical implications affect various stakeholders. So, let's talk about the stakeholders and the solution. Patients face risks of misdiagnosis, data misuse, and reduced autonomy, especially if they are unaware of AI's role in their care. A concern tied to informed consent. Clinicians might over rely on AI, potentially weakening their professional judgment. Policymakers and healthcare institutions grapple with outdated regulations and the challenge of ensuring equitable access. Marginalized groups often un- marginalized groups often underrepresented in AI datasets may see widening health inequities unless inclusive data practices are adopted. Additional worries include privacy of genetic data, especially with third-party involvement and inadequate and unequal access to AI tools, which could exacerbate and existing disparities. Ethical frameworks offer a path forward. Principalism rooted in autonomy, beneficence, non-maleficence, and justice provides a strong foundation. The AI for People framework, aligned aligned with EU guidelines, promotes transparency, fairness, and expli- explicability, explicability and emerging approaches like data feminism, championed by this analyze AI through power and intersectionality to uncover structural inequalities. These tools guide developers and policymakers toward responsible AI integration. At the end, AI holds immense potential to transform healthcare, but its success hinges on rigorous ethical scrutiny. Developers must prioritize diverse, re- uh, diverse representative data to eliminate bias. Policymakers need to strengthen policy laws and update regulations. Transparency and explainability must be embedded in AI systems to build trust, and human oversight should complement, not replace, clinical judgment. By embracing fairness, accountability, and transparency, we can harness AI to enhance care while safeguarding human dignity and reducing social injustices. Thank you for joining this session. Let's work together to shape an ethical AI future in healthcare.